I really hope that one of the silver linings of the pandemic is that the national and international conversation around mental health, it changes, that people are able to reflect on the things that are important.
We've found our ability to be flexible was much larger than we thought previously. Our ability to innovate quickly and respond.
The COVID experience have really given a new voice to vaccines, to vaccine developers, and to those of us who have dedicated almost our life and have been prepared for this.
It's inspired people to adopt new measures that will hopefully help us be able to track viral illness better and be able to zoom in on different locations and geographies and be able to identify where outbreaks are occurring and hopefully do that in real time.
We have utilized more broadly tools that perhaps were available already to us and that we weren't actually used efficiently or effectively. The amount of information that we have been able to exchange without necessarily meeting in person because we couldn't, I think that's something that's going to stay. It's going to make our jobs more efficient, our ability to collaborate with others improve.
If there can be a silver lining out of COVID, it's the fact that it has heralded the wave of adoption of telehealth technologies. So for probably 2 decades now, we've been deploying telehealth systems throughout the world, actually, and it hasn't achieved great adoption. It's not so much the technology, it's probably more political barriers and funding models, I guess. But with COVID, there was not a choice.
Access to the hospital had to be limited. Our outpatient clinics had to be closed. Now those same tools, we're now looking into using them in the future to provide better services to our patients.
There may be people who would prefer and would be even more likely to attend their appointments if they're given the option to be able to attend them virtually.
Beyond the pandemic, just thinking about patient outcomes, thinking about costs, thinking about telemedicine, remote care, all this kind of stuff, I think if anything good comes out of the pandemic, it's an awareness that the technology is here, it's now, it's possible, why aren't we doing this? And so I think we're seeing a lot of momentum build.